Guys, I'm going to show you how determined you have to be when you want to pursue a residency program, just to give you an idea. So to do oral and maxillofacial surgery, you have to have a medical and a dental degree. In some instances, you can do it with a dental degree only. It's a 4-year program and a 6-year program. Now, I'm giving you quotations based on a person coming from a supposed third world country. It probably costs more if you're in the United States. If, for instance, trying to get it from a dental school in the United States into the program in the US. So you go to the medical school or dental school. Each year costs about $30,000. So that's 5 years for your first degree alone. So that's 5 threes, that's 15. That's 150,000 US dollars you need for for dental school if you do it first. Medical school, the first 2 years, you probably would get exempted from that. So then you go into your dental third, fourth, and fifth years, which would be another. That's 3 threes, 9, that's 90,000. So that's 150,000 plus 90,000, which is $240,000. Okay. If you choose to do your examinations through your dental or your medical degree, you then have to do USMLE, which will come to roughly $9,000 to $10,000. So that's $250,000 there. Then you do your MBDE examination, and also you do your CBSE exam, and you may do your licensing exam, which maybe like about $5,000, give or take a few. If you want to go to the US, so that's $255,000 right there, just right there alone. Then you have, if you want to go to the United States, you have to go back to school. So you have to go back to your third and fourth years of your clinical training of dental school. So you have to go and spend $140,000 just for the tuition alone. So that now comes to $395,000. That's excluding living expenses. Maybe you can add another $30,000 or $40,000, or call it $30,000, right? So that's $425,000. So essentially, to be an oral and maxillofacial surgeon from a third world country, you need $425,000 US to specialize in the United States or even Canada. Now, this will put things into perspective. If you're a medical doctor and you finish a program, for instance, if you study to go and be a general surgeon in the United States, to do the USMLE licensing examination, is $10,000. So once you finish your medical school and you're in the supposed third world. I do third world like this because it's third world, but we're still very well trained. It's just that our degrees are not recognized based on the world powers classification of what's a suitable or a recognized medical qualification. So even though we're third world, we're still well trained. And if you get sick in the Caribbean or pretty much anywhere throughout the world in a supposed third world country, as long as if the university is old, like when I say old, not like started last year, started within the last 50, 60 years, it's a pretty decent school. And a lot of them are based on training from the United Kingdom or United States or Canada. So if you do your licensing examination, your USMLE right out of school, you spend about $150,000 plus the $10,000, which is $160,000. So right there you see the difference between the USMLE and the residency, trying to match for residency outside of a medical school or medical degree versus trying to pursue oral and maxillofacial surgery. There's almost a $250,000 difference. So I say all of that to say this. The money's not going to be easy to come by. Like, I'm struggling. I'm telling you straight off the bat, I'm struggling. But I'm not looking at it from the point of view of the now, because the now is pretty rough. So right now I'm in an office. I'm working, as you can see. I'm in an office waiting for a few patients to come in, hopefully to make a few extra dollars. I mean, I'm just thankful for a job, that's the truth. And I know that if I want to go to the United States, I have to take a loan. I mean, hell, I want to take a loan right now for dental school because, I mean, working and studying is just not working out. And the university wants their money in full. So, I mean, $425,000. I mean, the average person will never see that amount of money in their lifetime. But you as an oral and maxillofacial surgeon, you could see that quite easily. So I'm just telling you all, it's an expensive specialty. That's why they charge so much. But there's also a flip side. Many persons don't choose a specialty because they can't be bothered to spend all this money, especially those coming from third world countries. I mean, most people here in Jamaica, there's 4. Barbados, there's none. Which I'm from Barbados, so there's 0 that I know about. And when I say 0, I don't mean that if you get a toothache or I need an extraction, that there will be nobody to take it out in Barbados. I'm not saying that. I'm saying that there's no, from what I have seen online and what I've heard, there's no formally trained oral and maxillofacial surgeon in my country. Trinidad has a few. Some of the other islands have 1 or 2 that come back and forth between the 2 islands, but in general, it's not one of the specialties that people choose. And I can't blame them. I mean, come on. So $425,000 is a lot of money. So I'm just going to keep working. But I know for a fact that I have to take a loan. I have to look for sureties, and I have to make sure that I keep employed. And it's long. It's a long training process. The good thing about coming from the third world country with a medical degree and a dental degree is that they may allow you to do the 4-year program. So the 4-year program, you just go do your 4 years and you're finished, as opposed to having to do the 6-year program. So you would then go and do the 2 advanced standing years, which should be the clinical years, year 4 and year 3 and year 4. Then if you're lucky or your grades are good, you can go straight into the program. So that's a blessing in itself. But I mean, yeah, it's a lot of money. I mean, I just sat down on here and I was just thinking, it's a lot of money going into this training process. But yeah. So anyway, today was a very short day. Fridays in the clinic, what they do is that they take referrals. They don't do many procedures. Even though we did a procedure today, they did like 2 extractions. One was root tips, and the other one was a second molar. Person had a carious lesion. I actually volunteered to try to do the procedure, but yeah, they didn't think that it was a good tooth for me to take out because of the fact that the crown had gone already. So they felt like it was going to break, but it came up with this elevation. The tooth flipped out of the socket, so that was pretty good. We saw that. Then I took a few referrals in the sense that the person who was doing the procedure, they're the person on call today. So the referrals were pretty interesting. One was an intracranial abscess. The other one was trauma to the face. So intracranial abscess, they wanted to rule out a dental cause. And then the trauma to the face, it was just trauma to the face. So the person had damage to the mouth. So that was it. We were dismissed right after that. Me and my co-student were dismissed right after that, so we could go home. But yeah, 5 days so far in, and it's been interesting. So hopefully next week I get to scrub. Next week I hopefully get to maybe elevate a bit. I want to do something, but I'm happy. I'm contented watching, but I still want to do something. So thanks very much for subscribing to my channel. Keep posted. I'll let you guys know what exam I plan to do, or what I plan to do if I plan to go and just go to school and forego doing the examinations until I get the financial clearance, but at least remain in school. I don't know yet. I've been asking colleagues what to do, because like I said, the university doesn't want part, they want it in full. So yeah, that's quite interesting. So guys, stay tuned. Thanks a lot for subscribing. This is day 5 of my oral surgery rotation.